Hi everyone, welcome to the Specialty Nursing Info Session. My name is Julie Alley, and here with me today I have Kathy Kennedy, Cindy Chang, Carly Eliadis, Soraya Ramazzini, Matt Thacker, and Jean Dehaan. We also have Erin Ujeri here with us to help us. Moving on, before we get started, the British Columbia Institute of Technology acknowledges that our campuses are located on the unceded traditional territories of the Coast Salish nations of Squamish, Tsleil-Waututh, and Musqueam. And now I pass it over to Kathy Kennedy, Associate Dean.
Great. Thank you, Julie. Welcome, everybody. We're happy to have you here today. And this session is recorded, so you can review it again. If there's several things that we talk about, feel free to review the recording. So specialty nursing here at BCIT offers advanced education to RNs. And we really do have a couple of programs that we're going to talk about, perioperative, as well as the nephrology program that also caters to LPN education. There's pathways, and Cindy will talk about that as we get closer to her section. But as you can see here, we have quite an extensive list of different areas that people work in specialty environments within the hospital. Great. And so, as I mentioned, we do have the pathways for RNs and licensed practical nurses. And then we have a pathway and a wonderful relationship with the University of Victoria, where after completing our advanced certificate, you can carry on and complete your Master's of Nursing there as well. So you'll hear about different programs as we discussed today, but we do offer our programs in a part-time delivery, sort of course by course format where students can take it at their own pace. And then we also have what we call industry sponsored. So it's a compressed full-time delivery. So you typically would come to us from your employer, from a health authority, and be on campus as well as in clinical and online learning, and doing it as a full-time program. So there's two different options as you move through. We do teach right across Canada as well as all over the province, a number of learners in different environments, and our programs cater to all of those. So you'll hear some of our members today talking about the clinical practicum. We really try to ensure that we get a site that's in your area that you're able to travel to. So we work with you to get as close to you as possible so that you don't have to travel far distances. Having said that, some learners that are up north want to come to the Lower Mainland and learn, and vice versa. And so we would work with your needs to make sure that we meet those. Our big challenge is just making sure that the clinical environment that we're putting you in meets the learning outcomes for your program. So we just need to make sure. So for example, if you're in the emergency department, you need to be working at a trauma center, we would need to ensure that we get you into those right sites. You would be responsible for your own transportation and accommodation while you're in your clinical placement. So who is this for? So active registered nurses in Canada, that's the first and foremost piece. We have diploma RNs that are seeking to complete their BSN, and I'll talk about that briefly in a moment. As mentioned, the LPNs that want to study, we have pathways in perioperative and nephrology. We also have what we call learning pathways, and we work with accredited undergraduate programs, and students are able to take some of our early courses. They can't complete the whole certificate, but they're able to take some of our early courses as they move through their final practicums in their BSN programs. And I think I mentioned about the Masters of Nursing pathway through UVic. So there's a link to that you can click on, and it'll take you to the requirements for our specialty nursing, and you can search each one of our programs and look at what the courses are like and the faculty that teach there and so on. It should be able to answer lots of your questions. And each one of the people speaking today, there's contacts for them as well if you want to speak directly to them. All right. So Jan wasn't able to join us today, but I did want to speak about this program. So Jan's program is the BSN core program, and it's designed specifically for diploma nurses, and there's still lots out there that are seeking to complete their BSN with a certification in specialty nursing. And so what that means is you would complete one of the advanced certificates and then move through core courses in order to get your BSN. And I think the next slide has a breakdown of that. So you can see at the bottom, it would be a diploma nurse that would start as an RN. Then they would complete any of our advanced specialty programs, and there's a number of them there. And then they would move through core courses, 39 credits that they would need to complete, and you would take those courses through Jen's program. And then you would graduate with your specialty BSN. This has been a very popular pathway for a number of learners that are coming through with their diploma and seeking leadership positions and so on. And then you can move through and complete your master's with you. Great, perfect. Yep. A lot of community health positions are very popular, and teaching positions as you're looking to complete your BSN. That's great. Next one, Julie. So there is a bit of an application. It's the only program that has a bit of an application process. The other ones are direct entry. But you would be connecting first and foremost with Jan as the program head, and she can guide you through this. All of this you can find on the website, so don't worry about writing it all down, but you just need to review some of the entrance requirements, just a demonstration that you have your diploma as a registered nurse, and there's some documents that we would need just to ensure that we have you on the right pathway as you're moving through your specialty nursing certificate. Perfect. Next slide. There you go. Is Jan's information. Oh, just go back once. Yeah, perfect. There's Jan Morrison's information there, and she is more than happy to speak with you and guide you through this process. And the next thing we're going to move on to, I believe, is the perioperative program, and Cindy Chang's going to join us. She's here, and we'll be able to talk you through that. Thank you.
Thanks, Kathy. So I'm the perioperative program head at BCIT here. So perioperative nursing, if for those who are unfamiliar, they are perioperative nurses who ensure safe care and support patients who require surgeries. So listed on the slides, you're going to see some examples of common surgeries that you've heard of or maybe experienced. So we do a wide variety of surgeries, from removal of a gallbladder, C-section, knee scopes, to also hip replacement. So there's so many varieties of surgeries that we do. And so one of the most rewarding part about being a perioperative nurse is to be able to fix a problem and ultimately giving an opportunity for a better quality of life for our patients. And then many people may assume that perioperative nursing do not involve much patient care or direct patient care. However, we do, it just looks different. So the main two roles that we deliver patient care is through the scrub nurse role and also the circulating nurse role. The scrub nurse role is often portrayed on TV that you might see as they're part of the sterile team. They're wearing all blue. You're going to see them working with the instruments with the surgeon. And then in the other role is the circulating nurse role. And they're the ones that, if you ever had surgery, they're the ones that check you in and make sure that the surgery is ready to go and set everything up. Yeah, so both roles, they advocate for safe practice and then also safe patient care. So who is this for? As Kathy mentioned, we have the pathway for RNs, or also undergraduate BSNs. And we also have pathway for LPNs who would like to advance and work in the operating room. The other pathway that we do offer are for perinatal nurses who would like to expand their scope of practice in the operating room, working and focusing specifically on C-sections. And to be and then so one of the things that we found to be some attributes that would help you to become perioperative nurses is to have strong interpersonal skills, some self-direction, self-initiation, and also flexibility to be working in a rapidly changing patient environment, and you're working with a team very closely all the time. And then just on the slide here, you're going to see that this is how our program is structured. We have 3 theory courses plus 3 clinical courses. And then altogether, it's 25 credits. And on the very bottom here, you're going to see that there's a perinatal periop course. That's the one that I was talking about, where the perinatal nurses will go through a modified version of this, of the theory and the clinical courses to focus on the C-sections. And then once you're finished with the advanced certificate in the perioperative nursing, you get to work in a variety of perioperative settings. So that could be a tertiary care unit, acute in the hospital, in the community hospital that has an operating room, private surgical clinics, and ambulatory care clinics. Other opportunities also include perioperative nurses advancing to expanded roles such as RNFA, which is a registered nurse first assistants, and they work closely with the surgeon and under the surgeon direction, but they would hold different roles, slightly different than a scrub nurse role. And then this is one of our past graduate students, and this is Maggie from Vancouver Island, and then she's saying that the BCIT perioperative program has been an incredible guide to starting my new career as a perioperative nurse. And the following slides will have a few more testimonials from students. If you could advance to the next slide. Yeah, here's a few more comments from past students. I'll just give you a moment to read that. All right, and then the next final slide is if you have any questions at all, I feel free to reach out to myself. The information is up there, and also Stephanie Strong, who's our program assistant, who can answer any questions as well. And then I'll pass it on over to Carly with neonatal.
Thanks, Cindy. Hi, everyone. Like Cindy said, my name is Carly Iliades. I am the program head for the neonatal program here at BCIT. So neonatal nursing is a subspecialty within nursing that works with newborn infants born with a variety of complications ranging from prematurity, birth defects, infections, cardiac malformations, and sometimes surgical issues. We can go to the next slide, Julie. So this program is very similar to the other programs that you've heard about so far. It's also for practicing registered nurses wanting an advanced neonatal certification, or to complete their Bachelor of Science in Nursing, like Kathy discussed initially. We also do have undergrads in our program, so undergrads can currently take our first 2 theory courses during their BSN. We do prefer 6 months of relevant work experience in an acute care setting, but that's just a preference. We do accept new grads and undergrads into our program. And also, of course, if you enjoy working directly with infants and their families and can apply sensitivity and compassion in a fairly high stress work environment, this program might be for you. Next slide, please. So generally, neonatal nurses work in neonatal intensive care units, but neonates can also be cared for in a variety of other settings, which may include the birthing room, a newborn nursery, palliative care, inter-hospital transport, even home care or neonatal follow-up clinics. Neonatal nurses are experts on fetal and neonatal development, the effects of maternal health, pregnancy, and birth on the developing fetus and neonate, transition to extrauterine life, and neonatal resuscitation. As a neonatal nurse, you would use evidence-based knowledge and skills to provide family-centered and developmentally supportive care to neonates and their families. A cornerstone of competent and ethical neonatal nursing practice is the ability of neonatal nurses to see infants as holistic beings with subtle but powerful communication and social abilities. As neonatal nurses, we practice with a trauma-informed lens, understanding that infants are extraordinarily vulnerable and that traumatic, stressful, and painful experiences are associated with adverse short and long-term outcomes. So neonatal care is very complex, it's very rapidly changing, and it requires a lot of interprofessional collaboration, extensive family involvement, as well as the ability to manage ethical challenges and uncertainty. People who generally enjoy working in this area, obviously, probably really like babies, but also really enjoy working with and supporting families. Family-centered care is really at the forefront of what we do in the NICU. It's also a very fast-paced environment, but we work in a very scheduled way and organized way as well. In the NICU, we look after infants ranging from extremely premature, requiring mechanical ventilation, central venous access, multiple medications, right up to babies that we call feeders and growers that are just learning how to feed and maybe need to grow a little bit before they can head home. Another major focus of neonatal nursing is providing trauma-informed and developmentally supportive care to infants. We've really learned a lot over the past several years about how stressful and traumatic the NICU environment can be for both infants and their families. So our main focus is really providing supportive care to ensure positive neurodevelopmental outcomes. So our program, our neonatal program, is comprised of 24 credits. There's 21 credits of core courses, which are a combination of both theory and clinical. And then there's 3 elective credits. So you can choose from some of our neonatal options, or you could also choose electives from other specialty nursing programs, such as pediatrics, perinatal, critical care. There's really lots of options. There are also multiple paths to becoming a neonatal nurse. Like I said before, you can take our first 2 theory courses in your undergrad. And then you might do your final preceptorship in the NICU and go right into working in the NICU after graduation. Or you might finish your BSN, work for a while in another area, and then decide to specialize. Also, as mentioned earlier, there is an option to take our program course by course, and there's also the option of a health authority sponsored compressed timeframe program. Oh, these are just some student testimonials from actual students in our program. So I'll give you a few minutes to just read those on your own. My favorite one is the bottom one. I like the end, it was quite fun, and now I have the greatest job ever. I would agree with that for sure. And then lastly is just our contact information. So feel free to reach out anytime if you have any questions at all. And I will pass it on to Sarita from the emergency program.
Thank you, Carly. My name is Sarita Ramazzini. I am the program head for the emergency and the pediatric emergency nursing specialty. Matt will speak to the pediatric emergency program in just after myself. So what is emergency nursing? Emergency nursing is a specialized area that has an energetic environment, is unpredictable, where quick decisions are made that positively influence patients' lives. So who is this for? As you can see, this program is for RNs looking for emergency certification or completing their specialty BSN in emergency. It can also be for undergraduate nursing students currently completing an accredited BSN program and may take the first 2 courses. A couple of characteristics of an ER nurse. So strong detailed assessment skills. Attention to detail is very important. Our patients don't walk through the door with diagnoses. We essentially act as detectives looking for these red flags or clues to figure out what's going on, what's happening, and how to best treat them. Having a curious mind. So one thing I love about ER nursing is that you're always learning something new. So being curious and always wanting to search a little bit deeper as to what's happening is really essential. Making order out of chaos. The ER environment is very fast-paced, chaotic at times, but you need to be able to slow down, take a deep breath, and organize yourself to be able to identify your sickest patient, think about your next steps, as things may change one minute to the next. Being proactive. So planning ahead and being able to anticipate your patient's needs is key. The moment you fall behind and are more reactionary in your approach, you're in trouble. So being proactive in your nursing practice rather than reactive is necessary. Knowledgeable, strong pathophysiology foundation. Our theory courses and clinical experiences are patho-heavy. Our curriculum is designed to introduce foundational concepts early in the theory courses and continue to build on that concept throughout the remaining theory courses. If you're someone who likes to work in a dynamic, fast-paced environment and have some of these characteristics, emergency nursing may be for you. The slide before, just the program overview. The emergency nursing program has been around for more than 35 years. Over these years, we've learned what nurses require to be successful and safe working in the very vibrant and chaotic environment of the ER. Our approach in our program is very learner-centered. We recognize all nurses have a tremendous amount of experience and knowledge. Our approach is very collaborative. We utilize a lot of different tools and resources to really meet our students where they are at in their learning. The program is a blend of comprehensive curriculum of both emergency nursing theory and clinical practice. The core courses provide the necessary pathophysiology, assessment framework, and nursing theory to allow nurses the opportunity to care for a diverse range of illness and injury from a wide age spectrum. The ER program consists of 6 courses, 4 theory courses, and 2 clinical experiences for a total of 24 credits. Here are some testimonials from students. Give you a second to read that. And what you can see is students really feel prepared coming out of our program. Here's my contact information as well as Maya's information. She's our program assistant and probably the first person that you'll come across when you email us regarding information. So please feel free to reach out and ask any questions that you may need. I will pass it off to Matt.
Thanks, Rita. That was great. Hi, everyone. My name is Matt Thacker. I'm the lead faculty member for the Pediatric Emergency Program at BCIT. I'm always excited to join these little information sessions and share everything about our program. So who is this for? I think it's important to stress, you don't necessarily need to be working in one of the two pediatric centers in BC, whether it's Surrey Emergency or BC Children's Emergency, to want to be able to care for kids in an emergency setting. Almost every emergency department that I'm aware of in BC and in Canada has nurses who care for kids in a variety of ways. So all you really need to want to do to be excited for this program is care for kids in an emergency setting. You can be practicing RN. We do have undergraduate options as well, where you can start taking some of our prerequisites to set yourself up quite nicely for once you graduate to continue on with our program. And you don't really need any relevant work experience. I think, kind of to echo what Carly said earlier, it's a little bit better. You might find it a little bit more manageable if you have a little bit of nursing experience in acute settings. However, that's not necessarily the case for everybody. And we have students who do quite well in our program who are new graduates to nursing. So we have a large spectrum of nurses who join our program, and they all do quite well and they really enjoy it. So what our program focuses on is a pediatric context to emergency nursing. So when you take our program, you're going to learn kind of all the foundations of what makes an emergency nurse. What is emergency nursing? And then to build on that, you're going to learn about all of the context that comes with dealing with pediatric patients in the settings. Obviously, it's a wide range of ages that you'll deal with, from a one-day-old baby to a 16-year-old just almost becoming 17. So there's a wide range of personalities, presentations, of disorders, of diseases that you're going to have a foundational knowledge on. And to assess these kids, you're going to have a lot of kind of background knowledge about how these kids present. And this is what we focus on in our program. How do you assess a child properly? How do you intervene properly? How do you talk to kids in certain ages? I mean, we all have nieces, nephews, sons, and daughters, and we know how funny they can be sometimes when we interact with them. So we really focus on emergency care in the pediatric context. And we go through everything from how to treat a fever to how to resusc some kids. So it's a wide range of topics that we cover. You might find, if you're kind of on the fence and you're not sure where your nursing career is going to lead you, there's some qualities that we've found benefit pediatric nurses. I think the big one is obviously you don't take yourself too seriously. I think you still have that inner child inside you that's screaming to be released. We really find, having that enthusiasm and that enjoyment of interacting with kids and to be sometimes a little bit goofy is a unique skill that's welcomed in these settings. But other than that, obviously great communication skills. Communication is so important in emergency settings. Time management, organization. You have to be able to support not only children in these settings, but the family as well. It's a huge component of what we do in the emergency room. So good communication, strong critical thinking, organizational skills, and just a passion to care for kids. And it's all you need to set yourself up quite nicely. So we have a couple options for you if you're interested in this program. We're very excited. It's the only program in Canada. And it's something that we let everybody know about. So that's great. But we have lots of different options. In BC, you can, again, take it as an undergrad, some of our prerequisite courses. Once you graduate, maybe to go back to that, undergraduate is, our two intro courses. You can also take it via distance. So if you have graduated from nursing school and you're not sure if you want to finish the whole program or you're not in an emergency setting, you can take our courses kind of one at a time. They take about 3 months each. We have 3 theory courses, 2 prerequisites, as well as a clinical component for sure. You can also take it if you do work in emergency. You can maybe have a conversation with your leaders at your department about sending you to us in a compressed time frame, and that's when you spend 3 months with us. You get a crash course, all the credits in that 3-month time period. And sometimes your employers can pay for you to actually come out of work and join us as well. So lots of different options. Our clinicals are very flexible. We offer this program Canada-wide, distance, and you can have clinical opportunities in some pretty neat sites across Canada. So it's great. Thanks, Julie. I think we have a video from one of our ex-students, Kyle. We're going to cue up here.
So thanks, Kyle, for coming out today. I know it's super busy in today's world, but I appreciate you taking a couple minutes here to speak to the program. So if you'd like to maybe just say hi and introduce yourself.
Perfect. Hi, my name's Kyle, and I previously worked in the emergency department at Children's Hospital. And currently I am a coordinator with the Vancouver Pediatric team and a clinic nurse with Insight.
Great. Yeah. Well, thanks for coming, Kyle. Thanks for sharing all of your insight. So, thinking back, you took our program a couple of years ago now. So just thinking back to that time when you joined, why did you decide to, take the leap and join the program, and what did you envision for yourself?
Yeah, the emergency department is one of those places where you get to be the jack of all trades, master of none. And it's a controlled chaos, and it's a perfect mix for getting a lot of things accomplished, but it doesn't really give you that opportunity to take a deep dive and to really understand and hone certain skills. So what I was really looking forward to with the program was the opportunity to consolidate my knowledge and my practice, and to get into that simulation world and prepare for those one in a million cases that PEDS is known for.
Yeah, I'm so glad you spoke to that, because that's a huge advantage of taking the time in these programs, right? Is to the ability to be a student again, and to be vulnerable and to learn all these things that we may not, especially in emergency, have the time to actually understand some of the things that we're seeing, because it's quite chaotic. So I appreciate you saying that. That's amazing. Yeah. So reflecting on your time at BCIT, what did you like about the program? What did you value in it? Reflecting on those 3 months.
Reflecting back on it, I really valued my time with the instructors. I felt coming into this experience, in some ways I felt like a nursing student all over again, but then working with my instructors and and the clinical instructors, it was as if we were peers and we were all learning together, which was a great environment to be in. The other piece that I really valued was the simulation, the amount of simulation practice, the equipment that was accessible to us. I felt that I could directly see from before I started the program to after my confidence in the critical care setting, and just being able to navigate what should be happening, how to advocate for clients, and just the communication level that should be there.
Yeah, I couldn't agree more. The team we have in our little program is quite amazing, and not only the experience that our instructors have, but also I think the networking as well. Pediatric emergency can sometimes be a little bit of its own little world. So that networking, learning from people so experienced and so knowledgeable, it definitely puts a perspective on everything. And I mean, branching off of that as well is that simulation staff that we have as well, and the experiences the work that they put into, for us as faculty and for you guys as students is quite amazing. And that's great. Well, thanks, Kyle. So the last little bit I would love you to speak to is, again, reflecting back, before you were entering the program and as you were moving through it, is where did you envision yourself, where did you envision yourself going with nursing, and where did you think it was going to take you?
Yeah. My big plan was either education or leadership. And one of the other pieces that allured me to the program was the frameworks and the processes that would help with teaching and supporting new staff and preceptors and in the emergency department. and yeah, just kind of looking at different master's programs for leadership and policy type things.
Great, yeah, and that's why I was really excited to have you come and speak, because now working in a pediatric public health lens, it just goes to show that the skills you learn in a pediatric emergency program can be extrapolated and threaded through any sort of either emergency or pediatric care that you kind of venture off into, and so that's amazing. Great.
Yeah.
Well, thanks, Kyle. Yeah, I appreciate you. I appreciate you coming, and I appreciate you taking the time out, and we'll see you around.
Sounds good. Thank you very much.
All right. Thanks, Scott.
Perfect. Thanks, Julie. Contact information for myself is there, as well as Maya, our program assistant, who's very helpful. If you have any questions, feel free to reach out. I thank you for joining me. Now I'm going to hand it over to Jean.
Thank you. All right, I can start again. Good afternoon, everybody. My name is Jean DeHaan. I am the current program head for high acuity specialty nursing. Next slide, please. So today I'm going to talk to you a little bit about our program, and I'll start with the learners who typically enroll in high acuity specialty nursing. They are quite varied. We have BSN students who are taking our first foundational theory course. We also have diploma RNs who have completed our advanced specialty certificate and use it to complete their Bachelor's of Science in Nursing via the BCIT core BSN program. This is the program that Kathy Kennedy discussed at the beginning of our presentation today. And finally, we also have post-BSN nurses who are advancing their nursing knowledge and skill set to be able to work on specialized high acuity units. So high acuity nursing is becoming more and more relevant on general and medical surgical units. The patients on these units are sicker today than they were 10 years ago. And honestly, I anticipate patient acuity will continue to increase over time, as it has over the last several decades. What high acuity specialty nursing education will afford you is a way to revolutionize your nursing practice to care for these patients with complex acute illness with multiple health challenges. Currently, BCIT offers the only high acuity certification program in Canada that is also accredited by the Canadian Nursing Association. I would also like to say that my colleagues that are present here today have also either completed their accreditation with the CNA or are in the process of completing it. So our accreditation going through our national organization is something that we're all very proud of here in specialty nursing. The high acuity advanced specialty certificate can be completed in both the part-time and compressed timeframe options. On average, the part-time approach to completing a program takes about 2 years. How slowly or how quickly you want to complete is really up to you, and our program is flexible, so we can accommodate your professional and personal needs. On the next slide, we have a video testimonial from one of our recent graduates. Her name is Karen Kapoor.
Hello, everyone. My name is Karen Kapoor, and I am a BCIT high acuity nursing student and a Fraser Health registered nurse. To anyone who is watching right now, I am so grateful that BCIT had given me a platform to speak about my passion for high acuity nursing practice. Why did I choose the high acuity specialty nursing program at BCIT? Ever since I graduated, I had always been interested in advancing my knowledge and education to broaden my scope of practice as a registered nurse. That is why I chose to apply to the high acuity specialty nursing program at BCIT. Because as a new graduate, you will be faced with many challenges in the workplace that requires higher level of thinking, nursing intervention, and escalation of care. What do I love most about the program and my career? What I love most about the high acuity program is the interactive virtual classroom discussions, laboratory simulation of real life case scenarios, and their supportive and understanding educators. BCIT provides one with the tools one needs to care for patients who are acutely sick with unpredictable outcomes. And the faculty does a phenomenal job of integrating theory into practice. I can really say that BCIT faculty theoretically and practically prepares you with the knowledge that you need to care for these acutely ill patients. Where do I see myself professionally in 5 years? In 5 years, I definitely see myself working in an intensive care unit. BCIT's high acuity nursing program does a good job of sparking one's interest in critical care training and preparing its students for the next step ahead. Thank you, everyone, and good luck on your journey.
Thank you. This final slide lists the our contact information. So my email as well as phone number is listed here. But we also have our program assistant information. Her name is Stephanie Wood. And again, she, as all of our program assistants, are often the first contact for any of you inquiring about any of our specialty nursing programs. And they have all of the information that you could possibly likely need. And that's it for me. Thank you very much.
Hi, everyone. I'd like to open it up now. If anyone has any questions they'd like to ask to the group, feel free to take the mute off your microphone and ask.
Hi, I'm Lauren. I am going into 3rd year of the BSN program at Vancouver Island University. I just have a couple questions about, as an undergrad, if I want to apply to take an upper level nursing elective at BCIT, is my application process any different than it would be as a graduated nurse?
I'm happy to jump in and answer that. Hi, Lauren. Thanks for your question. Certainly, depending on which program you're interested in, but all of our programs typically offer the first 2 courses to undergrad students. And so there's not really an application process, more just connecting with the program head and getting approval and then registering your first course.
Thank you.
Thanks, Lauren.
Hi, my name is Joanne, and I'm a incoming 3rd year BSN student, and I would like to get some courses for my elective. I wonder if I need to create my BCIT ID for me to register in one of your courses.
Right, Joanne, thanks for the question. You definitely need to create a BCIT ID in order to register. So when you go on to register, it'll prompt you to create your BCIT ID. And then once you do that, that number, much like where you're going to school now, will stay with you forever. And that would be the first step. And then you could just go forward and register.
Amazing, thank you.
Thanks, Joanne.
Hi, I'm Carla.
Hi, Carla.
Hi, I am an old nurse. I graduated from BCIT, the diploma program, in 1995, way back in the late 1900s. I've been working in medical surgical since then. I'm off on disability. I had back surgery. So I'm needing to make a change. And I wish I did this a long time ago, but I'd like to get into public health, working with kids. I have 3 kids myself that are grown up now. So I'm just looking to get into that journey. I'm scared.
You know what, Carla, you are not alone. You're in good company. We have lots of learners that come either fresh out of nursing school or 20 and 30 years post-graduation from nursing school. And the programs across the board, all of the program heads will probably nod when I'm saying this, but they're going to meet you where you're at. They're going to meet you with what you need and what you come with. So please don't let that be something that stops you. Jump into the program. If you're interested in kids and community health, I would certainly suggest our pediatric. We have a pediatric stream. Yeah. So we have those courses, as Matt talked
I was
about
looking at that.
Yeah, it's a great stream. And as Matt talked about the pediatric emergency program, if you're interested in a little bit more on down that path, that's also a wonderful pathway.
Okay.
And excuse me, Jean DeHaan's program, the high acuity program, it might not necessarily just be about getting you set up for a pathway to work in ICU, but also might be a really good refresher for strong pathophysiology and things like that.
Right.
That you might be interested as well. So there's
Okay.
a couple of different, angles that you could go with that, depending on what you're looking for.
Okay. Is that something, if you're wanting to work in the community, maybe getting away from the hospital, getting away from the shift work, would you do your clinicals in a community setting over the hospital setting if you just did the plain old pediatric course, not emergency nursing?
Yeah, we can certainly look at placements for you that are going to meet the needs of your clinical.
Okay.
One of them I would think would probably be in a hospital, because then you're going to get the volume of patients that you need.
Right.
But there's certainly a world where you can do a placement in a community setting for pediatrics.
Okay.
Yeah.
Okay. Wonderful. Thank you so much.
Great. Thanks for coming today, Carla.
Thank you.
I see there's a question in the chat. So you recommend a specific specialty that can help with becoming a nurse practitioner in the future? Gosh, most of them, but I would say if you're thinking of working as an acute care nurse practitioner and you have a certain area that you want to work in, emergency, perioperative, and so on, then it's a really good to get a pathway going with that. So if you have a certain area, we do have a number of nurse practitioners that take our courses as electives. And we currently are working very closely with the nurse practitioners on a national level with regards to type of education to support them. So it depends what area that you're wanting to go into for nurse practitioner. Thank you, Carly. I see you put Tara Hodgson's information up there for the pediatric program, Carla. So you might want to connect with Tara. She's great at helping navigate what you're talking about. I think we're good, Julie. If you have any other questions, please feel free to reach out to anyone who spoke today, or you can go through our website and connect with any of the other program heads of the programs we didn't speak about today. They're always here for you and happy to chat.
Thank you so much to Kathy and Sarita, Carly, Matt, Jean, and Darren. I didn't forget anyone. Thank you so much. And if you have any questions, yes, feel free to reach out. You will all be getting a copy of the slide deck and the video recording in your email within the week. Thank you again.